Democratic Society was commissioned by the Royal Society of Edinburgh to conduct a rapid review exploring international approaches to communication and participation during the COVID pandemic. As case studies, we looked at Belgium, Brazil, Finland,
Canada, Ghana, New Zealand,
South Africa, and Taiwan.
It turns out that communication was used to drive participation, but participation was largely understood to mean compliance with national efforts.
Science-based communication, or informing, educating, and raising awareness on science-related topics, was mainly carried out by public health officials to convey the seriousness of the pandemic.
Science communication was also used to justify lockdown measures and encourage the public to follow the rules and regulations.
There was a lot of information broadcast to the public from official sources, but citizen participation in helping design the crisis response and being part of decision-making was uncommon.
This basically means there was a lack of conversations, dialogue, and collaborative decision-making.
But when we did see it, it was thanks to the use of tried and tested networks, such as community health workers in Brazil and South Africa.
Social media influencers in Finland, or the Maori community rallying together to organise a tailored response in New Zealand. What also came through the research was that pandemic responses cannot rely solely on the expertise of public health officials,
but need to include citizens.
This will help create a more human strategy that factors in everyday lived experience, including elements of creativity and humour. This can be done through democratic dialogue and debate, not enough of which took place during the pandemic.
So, to make rapid, collective decisions in times of crisis, it is crucial to invest in equitable, collaborative, and participatory decision-making structures, both beforehand and continuously.
The Royal Society of Edinburgh will use these learnings to stimulate improvement in public debate and participation.